name is Shauna Puritan. I'm a dietitian and certified diabetes educator at Native American Health Center. Today I'll be showing you how to use a glucometer to test and record your blood sugar at home. This is what a glucometer looks like. A glucometer is a fancy word used to describe a device that is used to read blood sugar. So why is it important to test your blood sugar at home? Seeing your blood sugar numbers regularly helps you to monitor and control your diabetes. It helps your doctor make medication adjustments to get your sugars to a safe level. It can also help you to make changes to your diet and exercise habits that improve your sugar levels. The good news is that if you can control your diabetes and your blood sugar, you can prevent the many risks associated with diabetes, including amputations, blindness, and kidney disease. After I show you how to use a glucometer, I will review when you should test your blood sugar and healthy numbers for your blood sugar. Let's begin. Your testing supplies are included in a test kit like this. And it includes your glucometer, which is the device used to test your blood sugar, and test strips, which are specific to the brand of your glucometer. In this case, these are contour test strips. Lancets, which are the needles that prick your finger, and a lancing device, which is a device that holds the lancet. Also, you will need a sharps container, which you will use to safely dispose of sharp objects. In this case, the only thing you'll be disposing of are your lancets. In addition, you will want a tissue or cotton or gauze that we'll use to put pressure on your finger in the end to stop the bleeding. Now you're ready to test your blood sugar.
Before you test your blood sugar, you will need to wash your hands with soap and water to ensure your testing site, which is one of your fingers in this case, is clean. The first thing you want to do is take a lancet and put it in your lancing device. The top of your lancing device comes off like a pen cap like this. Then you put the base of your lancet into the holder inside the lancing device. Once you have the lancet firmly placed in the holder, you can twist the safety cap off to expose the needle. You want to place this cap aside since you will use it to safely remove the lancet later. Now you can place the cap of the lancing device back on. Now you want to prep your meter by inserting a test strip. Take a test strip out of the container. All test strips have an end that looks like piano keys like this that goes into the meter face down. The end that sticks out has a dark rectangle at the front that is basically a magnet that sucks up your blood so it can be read by your meter. Now as I put the strip into the meter turns on automatically. The meter is ready once you see a drop of blood flashing. Now you are going to take the lancing device and adjust the needle depth to the lowest setting first by twisting the top all the way up. This will make the process of pricking your finger less painful. If the lowest depth does not work, you can adjust it to the next level. Now pull the button on the top of the lancing device until you hear a click. This means the lancet is ready to use. To prick your finger, hold the lancet firmly against the side of your finger. You want to prick the side, not the middle, since it hurts much less. Now press the button in the middle of the lancing device to draw the needle into your finger. Once you feel a poke, take the lancing device away. Now hold your finger and rub it from the middle towards your finger poke to get a drop of blood. Once you have a drop of blood this size, hold your finger up to your meter and put the blood drop right against the dark rectangle at the front of the strip so the strip can drop the blood from your finger. Your meter tells you once it has enough blood to read, and then a number appears that shows your blood sugar reading. Mine is 90. Your number will save in your meter, but it is also helpful to write it down in a log, which I will show you how to do in another video segment. Lastly, take a piece of tissue, gauze, or cotton to put pressure on your finger to stop the bleeding. Then remove the cap of your lancing device, Place a safety cap on the end of the lancet and carefully remove the lancet. Some lancing devices have an eject button that you can press to release the lancet. Once you remove the lancet, you need to dispose of it in a sharps container for safety precautions. Once your sharps container is full, you can take it to a hazardous waste disposal site and they will dispose of it safely. That's it. Now that wasn't hard, was it? How do you know if your blood sugar is at a healthy level at home?
When you are first diagnosed with diabetes, your doctor will usually recommend you to test your blood sugar before your first meal of the day, which is when you are fasting, daily, and 2 times a week after your largest meal. The number you see on your glucometer when you test your blood sugar will tell you if it is at a healthy or safe level. You also want to make sure you carry your glucometer with you all the time and test your blood sugar anytime you feel unwell or funny to make sure your blood sugar is not too low. I will review what you can do if your blood sugar gets too low later in this video. A healthy level for your blood sugar when you are fasting or when you first wake up in the morning is between 80 and 130. When you test your blood sugar after meals, you want to test 1 to 2 hours after the start of a meal, and a healthy level after that would be below 180. So, for example, if I'm going to eat my dinner at 6 o'clock, then I'm going to wait 1 to 2 hours and test my blood sugar between 7 and 8.
Your blood sugar numbers will save to your glucometer so you can review the results later. However, it is more helpful for you to record your numbers in a log like this to see any patterns to your numbers. For example, you might notice your sugars are higher one day if you ate something different. I will show you how to use this log to record your results from your glucometer. Like I said earlier, at first your doctor will recommend you to test your blood sugar every day before your first meal, and about 2 days a week after your biggest meal, which is commonly dinner for most. On this log, you can record your results before your first meal of the day in this column, and your results after your dinner in this column. Also remember, you will want to test your sugar 1 to 2 hours after the start of your dinner. Each line represents a different day. I will use my results for today as an example. I will write today's date here, which is April 21st, 2020. Then I will write my result from this morning before breakfast here. And the result before breakfast was 105. Then I ate dinner starting at 6, so I tested my blood sugar at 7 p.m., which was 1 hour after I started dinner, and the result was 150. So I will write that here. There is also a column here for you to indicate any special circumstances that may have made your blood sugar higher or lower than usual. Today I ate a lot of pasta and noticed my blood sugar was higher than usual, so I will write that here. You can continue to write your results each day like this. Then remember to bring your log with you to each appointment to review your results with your provider. It is important to always carry your glucometer with you because you need to test your sugar whenever you feel unwell to make sure it is not too low. Hypoglycemia is another word for low blood sugar. These are symptoms you might experience if you have low blood sugar. Feeling shaky, sweaty, dizzy, having sudden behavior change, feeling hungry, weak or tired, having headache, or feeling nervous or upset. If you ever experience any of these symptoms, it's important to test your blood sugar. If you test your blood sugar and it is below 70, this means you have hypoglycemia and need to get your blood sugar up right away to prevent further complications. To raise your blood sugar, you can take a half a cup of juice or soda, or you can take 5 to 6 hard candies you can chew quickly. Then wait 15 minutes and test your blood sugar again. If it is still below 70, you need to repeat the process of treatment. This again includes taking a half a cup of juice or soda or chewing 5 to 6 hard candies and waiting another 15 minutes to test it again. Once your sugar is back to a safe level above 70, it is important to eat a regular meal to keep your sugar level. You should not experience hypoglycemia regularly. If you do notice your sugar is low frequently, you need to contact our clinic to speak to a nurse or doctor so we can adjust your medication and keep your sugar at a safe level. I hope that now you know how to use your glucometer and how it is helpful for you in controlling your diabetes and preventing any complications that can result from diabetes.
If you have any further questions, you can call our main clinic at 510-535-4400 to set up an appointment with our nutrition and diabetes department or your primary care provider. Also, if your blood sugar is consistently too low, below 70, or too high, around 400, it is very important for you to call us to set up an appointment right away so we can help get your blood sugar to a safe and healthy level. That's it. Have a good day.